with multiple internal echogenicities and cystic areas as well. Anteriorly you are seeing is the spleen, and posteriorly what you are seeing is the a mass with, you do see a slight posterior wall enhancement, and it is because of the fluid component within this complex mass seen at the upper pole of the kidney. Now this kidney is normal here. Its lower pole, mid regions are normal. The mass is not giving any mass effect, and the mass is moving with the kidney. Now patient in supine posture. With patient in supine posture, you see the movement and trying to cut the rib shadow so that you can have a good view. You can also see it in this position. Now it shares the capsule of the kidney, or it does not share the capsule of the kidney. You see, it shares the capsule. This is the mass, the solid area, and this is the capsule, and you see here the capsule is being expanded. So it is expanding the capsule, and then this is the posterior part of the mass. Here lies the posterior capsule, and the posterior capsule is again in continuation with the outer surface of the mass. So this mass relates to the kidney. This is the mass. You saw its appearance. It measures approximately 5.8 centimeter into 5.3 centimeters as inhomogeneous appearance with no significant posterior wall acoustic enhancement that would have been here in this region. No strong back wall is seen. So we see so far a solid mass relating to the upper pole of the right kidney with no mass effect on the adjacent central sinus echo complex. Now what about the echogenicity as compared to that of the remaining normal kidney? What is the echogenicity difference between these two areas? Now you see that this echogenic area has an echogenicity that is slightly less as compared to the renal parenchymal echogenicity, or almost equal, you can say, to that of the renal parenchymal echogenicity. So the mass has the appearance that is not increased, rather it has the echogenicity that is almost equal to that of the adjacent normal renal parenchyma. And you see it is gliding over the source muscle with the kidney. This is the source muscle. This is the source transverse muscle, and the mass is riding with the muscle. So this picture is very much consistent with renal cell carcinoma until unless proven otherwise, whereas the other differential would be now. Here you see that it is continuous with the anterior surface of the right kidney.